10 bad daily habits that ruin your kidneys. Do you know that over 30 million people in the United States have some form of kidney disease, and many of them are unaware of it? Kidney disease is a serious illness that can harm your heart, bones, immune system, and even your brain. It can potentially cause renal failure, necessitating dialysis or a transplant to survive. But did you know that some of the things you do every day without thinking can harm your kidneys without you ever realizing it? In this video, we will discuss 10 daily habits that might harm your kidneys and how to avoid them before it's too late. So, without further ado, let us begin. Number 10 is overusing pain relievers. Many people utilize over-the-counter pain relievers such as NSAIDs and analgesics to alleviate their discomfort. However, these medications can seriously affect your kidneys, especially if you have kidney disease or take them frequently or in excessive quantities. According to the National Kidney Foundation, NSAID can reduce blood flow to the kidneys and promote inflammation and scarring in the kidney tissue. Analgesics such as acetaminophen and aspirin can potentially harm your kidneys if taken too frequently or in high amounts. So how can you protect your kidneys from pain relievers? It is better to use them as little as possible and never exceed the recommended dose. If you suffer from chronic pain, consult your doctor about alternative treatments such as physical therapy, acupuncture, or meditation. Number 9, eating too much salt. Salt is really beneficial to your body. It aids in the maintenance of fluid balance as well as nerve and muscle function. However, too much of it can be harmful to your kidney. Because salt contains sodium, it can raise your blood pressure and make your kidneys work harder to eliminate excess fluid and sodium from your body. High blood pressure can harm your kidneys' tiny blood vessels, reducing their ability to filter your blood. It is, in fact, one of the leading causes of kidney damage and failure. So how much salt is excessive? According to the American Heart Association, your sodium intake should be limited to no more than 2,300 mg per day, or roughly 1 teaspoon of salt. However, most people consume far more sodium-laden processed foods, such as canned soups, frozen dinners, snacks, sauces, and condiments. Eat more fresh fruits and vegetables to reduce your salt intake. Cook from scratch using herbs and spices instead of salt, and carefully check nutrition labels when purchasing packaged meals. Number 8, ignoring urination urges. Do you ever hold your pee because you're too busy or there's no bathroom nearby? If you do, you may endanger your kidneys. When you ignore your pee demands, urine stays in your bladder longer. This can cause bacteria to proliferate and cause urinary tract infections. UTIs are uncomfortable and inconvenient, and if left untreated, they can spread to your kidneys and cause catastrophic harm. So how can you avoid UTI and protect your kidneys? The best thing to do is to listen to your body and use the restroom as necessary. Try to empty your bladder entirely every time you urinate, and don't hold your pee for longer than 4 hours. Before we continue, if you've enjoyed the video so far, hit the like button and don't forget to subscribe and click the bell icon so you don't miss any future videos like this. Number 7, not getting enough sleep. Sleep is necessary for your health and well-being, but did you know that it also has an impact on your kidney health? Your kidneys' function and activity are regulated by a circadian rhythm or a natural 24-hour cycle. Your kidneys minimize their workload and rest when you sleep. When you awaken, your kidneys restart normal function and begin filtering more blood. This cycle aids in the maintenance of your kidneys' efficiency and equilibrium. When you don't get enough sleep, your circadian cycle is thrown off and your kidneys are unable to function properly. People who slept less than 5 hours per night had a 66 higher chance of getting kidney disease than those who slept 7 to 8 hours per night, according to a study published in the Journal of the American Society of Nephrology. Another study discovered that patients who slept more than 9 hours each night had an increased risk of renal disease, implying that both too little and too much sleep can be hazardous. Sleeping 7 to 9 hours each night is suggested for adults. Try to stick to a regular sleep pattern to increase your sleep quality and quantity. Before going to bed, avoid coffee, alcohol, nicotine, and big meals. Limit your exposure to strong light and screen time at night. Make your sleeping environment pleasant and dark, and try relaxing techniques like meditation, yoga, or breathing exercises. Number 6, eating lots of meat. Protein is a very beneficial food for your body. However, too much animal protein might be harmful to your kidney. Animal protein causes a lot of acid in the blood, which can harm the kidneys and lead to acidosis, a disease in which the kidneys can't get rid of acid fast enough. Renal stones, bone loss, muscle wasting, and chronic renal disease can all result from this. How much protein do you require? The dietary reference intake for protein for adults is 0, 8 grams per kilogram of body weight per day. This means that an average person weighing 70 kilograms, 154 pounds, needs approximately 56 grams of protein each day. However, this amount may vary according to your age, degree of activity, health status, and personal preferences. To keep your protein intake balanced and moderate, incorporate more plant-based protein sources into your diet, such as beans, lentils, nuts, seeds, tofu, and quinoa. These meals are strong in protein while also being low in acid and high in fiber and antioxidants. Number 5, not drinking enough water. Water is necessary for survival as well as for your kidneys. Water aids in the removal of toxins and waste products from your body through your kidneys. These waste products can accumulate without proper water, causing complications such as kidney stones and chronic renal disease. Drinking plenty of water is, in fact, one of the best methods to avoid kidney problems and keep them functioning properly. So, how much water do you require? The amount of water you require is determined by a variety of factors, including your age, weight, activity level, climate, and health problems. A good rule of thumb is to drink 1.5 to 2 liters of water every day. However, depending on your specific requirements, you may require more or less. Drink water throughout the day to stay hydrated, especially before, during, and after exercise or whenever you feel thirsty. You can also drink herbal teas, juices, or soups, but avoid drinks with caffeine, alcohol, or sugar because they dehydrate you and injure your kidney. Number 4, eating manufactured meals. Processed foods are foods that have been modified from their original condition, typically by the addition of salt, sugar, fat, preservatives, or artificial flavors and colors. They are convenient and delicious, but they are also extremely harmful to your kidneys. This is because processed meals are heavy in salt and phosphorus, 2 elements that, if ingested in excess, can induce high blood pressure and kidney stones. High blood pressure stresses your kidneys, and kidney stones are painful mineral deposits that occur in your urinary system. People who ate more processed foods had greater amounts of phosphorus in their blood, according to a study published in the American Journal of Kidney Diseases. This can cause kidney damage over time. So how can you avoid eating processed foods? Increase your consumption of fresh fruits and vegetables, whole grains, lean meats, and healthy fats. Cook your own meals as much as possible and flavor your food with herbs and spices rather than salt. Read the nutrition labels on packaged goods and choose alternatives with reduced salt and phosphorus. Number 3, not exercising enough. Exercise aids in the maintenance of a healthy weight, lowering the risk of obesity and diabetes, two of the top causes of kidney disease. Exercise also helps to reduce blood pressure, which protects your kidneys. People who exercise regularly had a much lower chance of acquiring kidney disease than those who did not, according to a study published in the Journal of the American Society of Nephrology. Adults should engage in at least 150 minutes of moderate intensity or 75 minutes of intense intensity physical activity per week. Muscle building exercises can also be done at least twice a week. Number 2, smoking. Smoking is one of the most harmful habits you may have for your overall health, but especially for your kidneys. Smoking destroys blood vessels, reducing blood flow to the kidneys. This can limit their ability to effectively function and filter out trash and pollutants. Smoking also raises your chances of getting kidney cancer, which is one of the most frequent types of cancer. A study published in the Journal of the American Society of Nephrology found that smokers had a 60 greater chance of getting kidney failure than non-smokers. So, the most important thing in this situation is to quit smoking as soon as possible. Remember that stopping smoking is excellent for more than just your kidneys. It is also good for your lungs, heart, brain, skin, teeth, and overall health. Number 1, drinking too much alcohol. Because alcohol is a diuretic, it causes you to urinate more frequently. This can dehydrate you and make your kidneys work harder to maintain your body's fluid balance. Alcohol also influences the liver, which creates urea, which is filtered by the kidneys. When you consume an excessive amount of alcohol, your liver creates more urea than your kidneys can process, which can lead to kidney damage. So how can you restrict your alcohol consumption? Alcohol consumption should be limited to 1 drink per day for women and 2 drinks per day for men. If you must consume alcohol, do so slowly and with food, and alternate with water or other non-alcoholic beverages. Drinking on an empty stomach or while thirsty or tired is not recommended. Your kidneys are critical organs that require special care. You can improve your kidney health and prevent or delay the progression of kidney disease by avoiding these 10 habits. Remember that prevention is always preferable to treatment. We'd like to hear from you now. Do you engage in any of these behaviors? Did you know they were causing kidney damage before seeing the video? Please share your thoughts and experiences in the comments section below. We love hearing them. Remember this, your health is your greatest asset, and you don't need to be rich to eat healthy. Maintain your health and enjoy your health. Thank you for taking the time to watch. Take care.